welcome to our show, Health and Wellness, Myths versus Facts. I'm Gargi Rawat. Now, over the last 2 years, both our mental and physical health has taken a hit as our inner and outer worlds were both disrupted by COVID. Anxiety, isolation, boredom, depression, stress, worry, the global pandemic had a significant negative effect on the well-being of many people. People also use the lockdown as an excuse to avoid physical activity. Now, regular physical activity can bolster your defense against any infection. For people who have diabetes, the benefits of exercise can't be overstated. People with diabetes and heart disease are generally confused about the right exercise for them. And today we have a panel of experts to address any of these doubts and questions that you may have. We're joined by Dr. Anirban Chakrabarti, diabetologist, RTIICS Sugar Chamber, Kolkata, and Dr. Mukul Kumar Bhatnagar, Professor Cardiology, Dr. Rajendra Prasad, Government Medical College, Tanda, Himachal Pradesh. Thank you so much, doctors, for joining us on the program today. And Dr. Chakrabarti, first to you, as we all know, exercise or any other physical activity is important for one's well-being. How does exercise help manage type 2 diabetes?
Thanks for having me on the show, Gargi. I think before we answer your question, it's important that we understand what makes us develop type 2 diabetes. I mean, it's essentially a disease of modern lifestyle. You know, Homo sapiens in prehistoric age didn't have any type 2 diabetes. The problem we have now is our diet is very high in carbs, things like rice product, wheat product, sweet stuff, potatoes, and so on and so forth. That causes extra glucose to flow in the bloodstream. Now, how our body tries to get rid of that is it tries to get it inside the cells so that the cells can use it for energy expenditure. Now, the problem is that if we have sedentary lifestyle where we do not exercise, the demand of the cells is very low. So the blood glucose stays in blood rather than going inside the cell. Now, if we do exercise, what happens is the demand of the cells goes up. So the glucose from blood goes inside the cell to be used as proper energy. Also, when we do exercise, we hopefully build up some muscle mass. And that is where extra glucose can be stored for time in need. So that is how, if you do exercise, your blood glucose in the blood will go down and hopefully will help you manage diabetes better.
All right. So what sort of exercises should be avoided with diabetes, and what type of exercises are safe then for people with diabetes? If you could tell us that, Dr. Anirban.
Well, there is no exercise that you have to avoid if you have diabetes. But the problem is that, for patients who are type 2 diabetes, they have developed type 2 diabetes because most likely they have prioritized something other than their health in their life. So essentially, most of these patients have some sort of comorbidity, like knee osteoarthritis, for example. Now, you can do any kind of exercise, but it's important that you speak to your doctor to make sure that the exercise you're planning to do is safe for you. For example, if you have knee osteoarthritis, you have to try and lose weight by following proper diet. Also, maybe using some medicine which are used in diabetes, which can help you lose weight. And try and avoid things like walking and running, rather go for cycling, swimming, quad strengthening exercise, things like that. Also, there's some caution if you're on certain types of diabetes medicine like sulfonylurea or insulin, which can lower your sugar to a dangerously low level. So speak to your doctor, understand what is safe for you and what medicine you are on, whether it is safe for you to do exercise or not. Otherwise, there is nothing that you have to avoid because of diabetes per se.
All right. Now, Dr. Chakrabarti, insulin resistance is a major cause of diabetes, and exercise reduces insulin resistance. Is it possible for newly diagnosed diabetes or pre-diabetes to reverse diabetes with exercise?
Absolutely. I mean, we see that, on a regular basis in our clinic. I'm sure all physicians, diabetologists, they do. If the patient follows the advice given, and that advice generally has some sort of dietary advice, some sort of exercise advice, but more often than not, the patient chooses not to follow those two advice, just to stick to the medicine. But it's a triad of treatment. You have to follow diet, exercise, and medicine. So we see it very often that pre-diabetes, they don't develop diabetes. Early diabetes, they reverse diabetes. even advanced diabetes, they can come down on the dose of medicine. Sometimes they can come down on the dose of insulin, and often they can come off insulin, provided they follow the diet and the exercise advised. So it's very common.
Welcome back. You're watching Health and Wellness, Myths versus Facts, and we're talking about health, exercise, diabetes, and managing heart health as well. Dr. Chakrabarti, what exercises should kids with type 1 diabetes follow? Can they continue participating in sport? What precautions do they need to take?
Well, type 1 diabetes is something different. It's a very unfortunate condition where, patients are unable to make any insulin for themselves. So they have to be on insulin to save their life. So there is no restriction as such because the patient has got type 1 diabetes, but it's quite important that the patient and their parents, because most of these are kids, they understand the illness properly with their physician, and also they understand what insulin they're on, how do those insulins work, how fast do they work, how to adjust the dose, because these are the important things that one needs to spend a lot of time understanding. Once you have understood this, there is no limit as such. There have been examples of loads of Olympic athletes or legendary Pakistani cricketer we had in the past who had been on insulin while they were actively playing internationally. So it's important that you understand your illness and the insulin, and there should be no restriction. But there's another aspect to this question, which is kids nowadays are having type 2 diabetes as well, not only type 1 diabetes. Now, type 2 diabetes is a lifestyle problem, as I already mentioned. So I think we as parents, we have to be extra responsible. If our child is overweight, we have to inculcate healthy lifestyle in them, healthy diet, healthy exercise, try and take them for a walk rather than sit them down for a video game, try and indulge in fruits and vegetables rather than sweet treats, for example. So in that way, we should be able to keep things under control if the kid is overweight. But to answer your question in brief, type 1 diabetes, if you understand your insulin, there is no restriction.
All right. So, this must have become more aggravated in the last 2 years, with COVID and kids sitting at home and, of course, an increase in screen time.
Yes, of course. We have to inculcate, as I said, healthy habits in them. So take your kid with you on a walk, play outdoor games, even play indoor games. You can do loads of exercise at home as well. So kids normally learn from watching the parents. So if we have healthy diet ourselves, healthy lifestyle ourselves, kids will try and copy that and have healthy lifestyle themselves. So it's like a criminal offense to me to have an overweight kid at home, because they cannot make those choices for themselves. It's us who make the choice for them. So we need to be extra careful with them.
All right. Chakrabarti, we were speaking about, being fit and exercising. So exercise plays a role in helping us stay fit. So what tips would you like to give to, exercise at home for people who are working from home?
Well, I think the first thing is that you have to prioritize your health. You have to realize that if you become sedentary, then you'll, in effect, you'll have high blood glucose unless your diet is extremely low in carb. So you need to do some exercise to offload that extra carb that we have in our diet. So any kind of exercise is good for you, even simple, anything that involves movement, because the leg muscles are the largest muscle that we can move during exercise. And if you keep on walking, count your steps, that will count towards a good sort of exercise to start off. But at home, there are more intense exercise as well, like high intensity interval training, which is generally like a 10-minute program. So you can easily have that at the beginning of your work shift and at the end of your work shift. It's important that you get up from your chair and do a bit of walking, maybe do 20 squats. That'll involve your quads muscles. and that will be high intensity as well. So you can do that every hour. Things like jumping jacks, skipping, these things are very easy to do unless you have problem with your knees, of course. You can try and get up get up the stairs rather than taking the lift. So these are very simple things you can do. If you're doing things like yoga, if you can include some sort of action in it, which is called power yoga, you can do that at home. You can do resistance band training, which will involve some sort of resistance training and build up your muscles, which will again help in long run. So there's these examples that you can do at home without any equipment really.
Right, and talking, about COVID and the lockdown, people have also got into the habit of ordering in food, and you spoke about, diabetes being this ticking time bomb, and food also plays a big role.
Absolutely. As I said, it is essentially the illness of modern lifestyle. So if you think of Homo sapiens, the food that they used to have, has hardly got any carbs. So we have to watch the carbohydrates we are having. Anything that's made of rice, anything that's made of wheat, anything that's made of potatoes, and any sweet stuff. These are the things we have to watch out for, especially if you have diabetes. But even if you do not have diabetes yet, if you have extra belly fat, it could be just a ticking time bomb, really. So it's time to watch your diet, incorporate more fresh fruits, fresh vegetables, and do regular exercise. If you can't do anything else, just walk.